Hi everyone, this is just a quick recap on allergies. I'm just going to make it very short. Uh, I just discovered that while going through anaphylaxis and clinical features of allergies, I have not touched some points and I've put them together in just a few minutes. Okay, let's go. Allergic clinical features could be urticaria. You see something swelling, bomb, and itchy on your body, could be anywhere from the skin down to the mouth, the throat, everywhere. And you could be sneezing, runny nose, and your throat could become swollen. And of course, angioedema. Also, you could be having watery discharge in your eyes, lacrimation, and when someone looks at your eyes or you look at your eyes through the mirror, you see that your conjunctiva are red. Um, I'm called red eyes or pink eye or whatever. Nasal congestion. Be having runny nose, some will quickly go and get over the counter medication and all sorts. Nausea, vomiting, and when it is severe, your blood pressure will drop. Hypotension. When the lungs are affected and the fluid is causing congestion and secretion along the respiratory tract, you'll be wheezing. And sometimes the wheezing could be so loud that without stethoscope, people around will notice that. But one thing, these are not specific signs and symptoms, but one thing will make it diagnostic enough about allergy. You will remember this is sudden. This is happening around the time you are in contact with the allergy. Whether it is that food, oh, it has happened just a few hours ago that I ate the food a few minutes ago, or that particular chemical or anything. You are going, you notice, you know it that no, this is not what has built up over days, is what could have been built up within few minutes. What are the treatments here? Find out the triggers and other multiple allergies. Once that could be done, you are halfway done. I mean, you will not be having repeated occurrences and you'll be able to get out of the current one faster. Because all you need to do is once you find out, then you continue to avoid the triggers like plague. You can eat different food, good things. We have good farmers all over producing all sorts of different foods, and you don't have to die because you are allergic to a particular food and you eat that food. Please don't eat other type of foods that you are not allergic to. Tell your healthcare providers about the specific medications that you are sensitive or allergic to. Don't die in silence, please. Good thing, a lot of ailments have different modes of treatment. So the particular medication that you're allergic to will not be the end of the world. They can always look for another one to help you. Inform the school for your children, please. Inform them. Let the class teachers know about the allergy of your case. Don't hide. It's nothing bad. It's not their own making. The launch coordinators should be aware and let the co-workers know at your place of work that you are allergic to this, you are allergic to that. Don't die in silence. It's not a shameful thing. You didn't commit any crime, so there's no reason to be ashamed not to declare your allergic status. Please keep EpiPen at home, keep EpiPen at school, and keep EpiPen in your car so that When it happens anywhere, it happens at home, push, you get. If it's at school, do the same. If you are driving along the road and it has happened, park, get it. How do we treat? First of all, use small quantity to test the possible reaction before you give full dosage of a drug that many people are allergic to, but you are not sure that this patient will be allergic to. So just give what you call a test dose underneath the skin. Look for local reaction. If there is, then don't give it systemically, please. Keep antihistamines, salbutamol, hydrocortisone, or methylprednisolone. I'm sure that those centers that give vaccinations and all those highly sensitive medications will keep them, because some patients that have never been diagnosed to be allergic to some of those medications may likely come down with them, then immediately be able to help with IV fluid, antihistamines, salbutamol, hydrocortisone, or methylprednisolone. Those will help. Please, part of making your identity known in such a way that will save your life is wearing bracelet to indicate that you are allergic or hypersensitive to a particular product or allergy. It's no crime. Let everybody know. In conclusion, avoidance of triggers is the core of the treatment. That's it. If you are able to identify the triggers, you've done the allergen test, you've done everything, then when you are able to avoid it, you're done. EpiPen is a life-saving medication if used quickly. Please get it and keep. Check my presentation on anaphylaxis, and that will help. Still, before rounding off, finally, when you have the EpiPen, make sure you know how to use it. Please, get EpiPen, know how to use it, know how to administer it on yourself if you're allergic. Teach your kids how to administer it on themselves if they are allergic. That will help. And remind yourself to call 911 immediately if it's becoming anaphylaxis. If you are having weakness, swelling in your mouth, and so on and so forth, please don't die in silence. Okay, thank you for watching my presentation. Kindly subscribe so that you can be getting this as soon as they are published. Thank you. I appreciate it.